Hi everyone, welcome to my channel. This is Jyoti Palakurti, family second year from Geetanjali College of Pharmacy. In this video, I am going to explain about the Cushing syndrome, including introduction, etiology, pathophysiology, signs and symptoms, diagnosis, complications, and treatment. Before going to this disease, we all want to know about the adrenal gland. Coming to the adrenal gland, which is located on top of the kidney, which has 4 layers: zona glomerulosa, zona fasciculata, zona reticulata, adrenal medulla, aldosterone, which is from the mineralocorticoids, cortisol from the glucocorticoids, DHA from androgens, and epinephrine and non-epinephrine from catecholamines. The layers which are arranged in from outer to the inner. In cortex, the 3 layers are present. Coming to the introduction.
The syndrome which happens when the body has too much cortisol hormones for a long term. The body makes too much cortisol by the using of some medicines like glucocorticosteroids and more abuse of an NSAID. Cortisol is sometimes called as a stress hormone because our body responds to stress. Cortisol also helps in this stress. Regulate body glucose, also called as blood sugar. It is a endogenous Cushing syndrome. Exogenous Cushing syndrome, also called as caused by the prednisone, dexamethasone, methylprednisolone. There is a difference between the Cushing syndrome and Cushing disease based upon the ACTH dependent and independent. Coming to Cushing syndrome, by the adrenal gland, there is a releasing of too high cortisol levels in the body. It is an endocrine disorder. Coming to the Cushing disease, it is the subtype of Cushing syndrome which is caused by the pituitary gland. Coming to the etiology, there is the main causes which is dependent on ACTH and independent of ACTH. ACTH is the adrenal corticotropic hormone which is secreted by the pituitary gland. ACTH dependent is mainly pituitary tumor, ectopic ACTH producing tumor, ectopic CRH producing tumor. ACTH dependent have high cortisol and high ACTH levels. Coming to the independent, adrenal gland tumor, exposure corticosteroids, hyperactive adrenal gland, ACTH independent, low level of ACTH and high cortisol. Coming to the pathophysiology, Cushing disease is the frequency of ACTH production remains the same, but there is a loss of normal circadian rhythm. In this flowchart, we observe that the frequency of ACTH remains same, so increasing of cortisol by mineralocorticoid activity, which increases the sodium and chlorine ions reabsorption. By the renin, angiotensin converted into angiotensin 1, later converted to angiotensin 2. This increases the sympathetic activity. By angiotensin 2, there is a release of ADH hormone which leads to the water absorption. This is called as RAS mechanism which leads to the hypertension and hypokalemia. Hypertension which elevated blood pressure, hypokalemia which decreases the levels of potassium. Coming to the signs and symptoms, there is a common symptoms like weight gain in the trunk with the arms and legs, weight gain in the face which is called as moon face, fatty hump between shoulders, pink or purple stretches in the body, thin fair skin that bruises easily, slow wound healing, acne. The symptoms which were differ from women and men. Coming to the women symptoms, thick dark hair on the face and the body. This condition is called Hirsutism. And periods irregular. Coming to the men symptoms, lower sex drive, reduced fertility, problems getting an erection. Some of the possible symptoms like sleeplessness, high blood pressure, headache, infection, skin darkness, loss of bone strength, stunted growth in children, extreme tenderness. Coming to the diagnosis, urine and blood test, saliva test, imaging test. Urine and blood test that measures hormone levels and show the body how much cortisol is expressing. Saliva test, which is normally in the normal body patients, typically rise and fall, but in who are affecting Cushing syndrome, there is a drops of the saliva in the evening. Some of the other tests like inferior petrosal sinus, that is the blood drained from the veins and into the pituitary gland, and some tests like specific test to access cortisol and ACTH responses. The source of high cortisol and ACTH levels can be identified using dexamethasone test, corticosprin, releasing hormone stimulating treat, etc. Coming to the complications of Cushing syndrome, hypertension, which is the elevated blood pressure, osteoporosis due to the breakdown of bones, fractures, brain stroke, diabetes mellitus, frequent infections, heart attack, thromboembolism. Treatment includes medicines to control cortisol production at the adrenal gland, include ketoconazole, alsosert, levoketoconazole, and mitapivat. Taper steroid dose down and wean patient off. Pituitary tumor, recession of the tumor, adrenal tumor, partial or total adrenal recession, chemotherapy, radiation, etc. If malignant. Ectotopic ACTH producing tumor, recession depending on the site, chemotherapy, radiation, etc. if malignant. Treatment include coming to the patient counseling. Reduce sodium intake. Excess sodium can worsen symptoms of the syndrome by increasing BP and Cushing weight gain. Reducing cholesterol, avoid fatty foods and eat more fibrous foods. The exercise like swimming and bicycling, which is not stressful to skeletal muscle. Maintaining the muscle with high protein, beans, lean meat, etc. Do not stop the corticosteroid use abruptly and without medical supervision. Relaxing in quiet environment for rest and sleep. Use meticulous skincare to avoid transmitase fragile skin. Avoid adhesive tape which can tear and irritate the skin. These are the reference objects which I took from the websites which give the best information to understanding the information about the Cushing syndrome.
Thank you for watching this video and spend your valuable time with me for watching this and paying it attention.